This presentation is about non-Hodgkin lymphoma, or NHL. The age group of focus is 60 to 67 years. Non-Hodgkin lymphoma is cancer cells that form in the lymphatic system, which is the immune system. White blood cells don't die, and new ones are still being created, which causes tumors throughout the body. There are two types of non-Hodgkin lymphoma. They are B cell and T cell. The more common is B cell. B cells produce antibodies that neutralize foreign invaders. T cell non-Hodgkin lymphoma is rare. T cells kill foreign invaders directly. The lymphatic system consists of lymphatic vessels, the lymph nodes, where the lymph is filtered, the spleen, the thymus gland, bone marrow, tonsils and adenoids, and lymphatic tissue is also found in the heart, lungs, intestines, liver, and skin. Signs and symptoms are as listed: swollen lymph nodes, fatigue, unexplained weight loss, night sweats, itchy skin, fever, chest pain, and difficulty breathing. Risk factors are age. Those 60 and older are of greater risk. Caucasians have a slightly greater risk factor than other races. Medications that suppress the immune system, such as organ transplant patients, put them at greater risk. Autoimmune diseases, a weakened immune system from viruses, such as HIV, Epstein-Barr infection, H. pylori, and Hep C infections. Exposure to pesticides and treatment of other cancers are all risk factors. Many people do not have risk factors that are in their control, so there is no sure way to prevent NHL. To reduce risk, people should avoid unnecessary exposure to radiation, avoid exposure to pesticides by following safety guidelines when using a pesticide, limit risk of viruses, and quit smoking and maintain a healthy weight and eat a healthy diet. To reduce the risk of viruses, avoid risk factors of HIV by avoiding intravenous drug use, having safe sex, and limiting the number of sexual partners. H. pylori should be treated with antibiotics and antacids. To avoid Hep C, avoid intravenous drug use, avoid exposure to blood, practice safe sex, as well as not sharing personal care items. To reduce the chance of catching mono, avoid anyone with mono, as well as not kissing or having sex with an infected person. Do not share personal care items. Tips for overall health and wellness may also reduce the risk of NHL, as well as all cancers. Those would include maintaining a healthy weight, keeping physically active, eating a healthy diet that includes fruits, veggies, and whole grains, limit red meats, avoid processed meats, sugary drinks, and processed foods. Here is a list of the references used to gain information for this presentation.